Hi, my name is Helen, and I wrote my senior honors thesis on social and structural factors that contribute to racial health disparities, and how these disparities are mirrored in higher cases and fatality rates of COVID-19 among Black Americans. And throughout undergrad, I've always been interested in these social, economic, and environmental factors that influence health outside of a strictly clinical setting. Then, when the COVID pandemic hit, I was working at the time in a COVID-19 hospital and witnessed firsthand the toll that this virus was taking, especially on more vulnerable individuals. And at the same time, the CDC was compiling data showing huge disparities in case rates and fatality of COVID-19 across racial lines. And the disparities brought up by this pandemic are not new, but are a reflection of a much deeper history of racial health inequity. And the ability to live a healthy life depends on a wide variety of social and economic resources that have been widely unavailable to Black Americans throughout history, primarily as a consequence of structural racism. Inequality has been deeply embedded within American society since its founding, and structural racism can be understood as the way that these inequalities are practiced and perpetuated across time and remain deeply embedded across multiple societal institutions, including the housing and labor markets, as well as our education, legal, economic, and healthcare systems. So my goal in writing this thesis was to examine and address the ways in which structural racism operates within institutions and policies, to restrict the goods, services, and opportunities available to Black Americans, and ultimately translates into the persistent health disparities faced by the Black community. The onset of COVID-19 pandemic provided an especially important lens through which to study racial health disparities, given that its quantifiable and disproportionate impact on Black Americans is illustrative of the larger forces that shape these fundamental health inequities. While writing this thesis, I turned toward public policy literature, ethnographic studies, analysis of social inequities, and public health data surrounding racial disparities in health in general and cases of COVID-19 specifically, both nationally and with a specific focus on the St. Louis area. Ultimately, these findings demonstrate that centuries of racism and injustice deeply embedded in our society have left Black Americans to shoulder an increased burden of poor health, social disadvantage, economic instability, and heightened risk of COVID-19. I believe that the disparities laid bare by this pandemic offer a critical opportunity to recognize that racism and inequality are not bygone problems of the past, but a crisis of the present in need of a national effort to address the longstanding roots of health inequity.